Are you currently suffering from a pinched nerve in your neck, causing arm pain, numbness, or tingling? Hey everyone, this is Dr. Zach Greenwood here at Performance Sport and Spine, and today's video will be discussing cervical radiculopathy, more commonly known as a pinched nerve. So the neck or cervical spine is comprised of 7 bones, C1 through C7. And then each segment is comprised of the body, the disc, the posterior element, and then the neural foramina, which is where the nerve root exits the spine. So what does this condition feel like? Often it presents as neck pain or stiffness, and then associated with pain in the arm, numbness, or tingling. The severity is often quite high, and then the quality is often described as burny, electrical, or stabby. And then depending on which nerve root is affected or compressed, it's going to affect a different part of your neck and or arm. So the C5 area is different than the C6 or C7. It is important to note that there is variation between these patterns on different people. What causes this condition? And there's actually 2 different subgroups. There's irritation and then compression. So for the first, think something is touching that nerve root and causing it to be irritated, and there's a chemical reaction causing pain. The second, something's touching that nerve root and compressing it. Think a kinked garden hose. Now this often associated with a motor deficit that you feel. So you might feel weakness, numbness, or loss of reflex. It's also important to know that these 2 can happen simultaneously. And the 2 most common structures that affect this nerve root is either the disc or the bony growth from the facet joints. The most common nerve root to be affected is C7, followed by C6, and then C8. And it's most often found in people in their 40s or 50s. And some risk factors to be aware of is being Caucasian, smoking, or having a lumbar disc injury. And then fortunately, about 80% of people will see significant improvement within 4 weeks of this condition. However, that latter 20% often have lasting effects. And if you please like our video, subscribe to our channel, and then don't forget to turn on notifications. And then in more rare cases, the spinal cord itself can get compressed or irritated, and this is called cervical myelopathy. And this is important to be aware of, and we'll discuss this in more detail later in the video. Now we'll talk about some ergonomic and then posture modifications to be aware of. When working with a computer, it's optimal to have the screen about eye level. You want to minimize or avoid positions where the neck is hyperflexed or hyperextended. And then it's best to avoid awkward prolonged positions such as working under a car or painting a ceiling. And then lastly, and probably most importantly, this condition hates prolonged static positions such as sitting or standing. So a lot of people will find helpful is that they know that their pain starts at 30 minutes, setting an alarm for 25 minutes so you can get up and move around before your pain gets worse. And now we'll go over the exercise and rehabilitation portion of this video. So now we're going to show you some repetitive motions or stretches that can help centralize the pain. So let's say your pain is going down your arm to your right wrist. You can do some cervical retractions. And as you repetitively do this, if your pain seems to get more proximal or go more up towards your neck, that's a good sign. You also can do protractions or retractions with overpressure. But again, it's more about, does the pain get more centralized or does it stay the same? This will be different for each person, so there's some trial and error. Neck isometrics is a great way to initially load the neck without flaring up your symptoms. So in a seated position, relax, place your hand against the side of your head, and then pushing your head into your hand with light pressure, hold for 6 seconds. After doing that, place your hand in front of your head and push forward. Again, hold with light pressure for 6 seconds. From there, use your other hand, place on the outside of your head, and then press leftwards, hold for 6 seconds. And then place either hand behind your head and press backward for 6 seconds. And then we'll give you a rough approximation of dosage, but it's important to increase both the duration and the frequency over time as your symptoms allow. So some scapular or shoulder blade exercises can be really helpful. So laying down, doing some prone T's, V's, and A's can help strengthen the area and reduce pain. And then mobilizing our mid-back or thoracic spine can be helpful. Thoracic cat camel. So on your hands and knees, sit as far back onto your buttocks. And then pressing down into the floor, we're going to round our back upwards to the ceiling, bring our neck down, and then we're going to arch or extend our back towards the floor, lifting our head up. Now, if you have an acute disc injury, this may be too much. So again, this should not be very painful, and it definitely should not increase your arm pain. At any point it does, you need to stop immediately. Again, arch down, bring your neck up as far as you can, and then round up. Sometimes it may help to decrease the intensity or reduce the range of motion initially, and then increase as your symptoms allow. And then a tall kneeling windmill. So in a kneeling position with the down leg against the wall, with the arm straight, we're gonna rotate our arm up against the wall, falling with our hand, and then back to the starting position. Again, initially, if you need to reduce the range of motion or bend your elbow a little bit, that's fine. But at no point should the arm pain increase through this exercise. Repeat on the opposite side. You might find that one side's tighter or more painful, so maybe you only start on one side and then progress to the other side as your symptoms allow. And then most importantly, the more healthy you are, the faster you're gonna heal. So having good sleep, good nutrition, adequate water, reducing any stressors that are in there, and then just general exercise. Probably the best exercise is just frequent walking. Again, the more you move lightly, the better it's gonna feel. If you hold any one position for too long, it's gonna hurt. Strenuous exercise should be avoided, but you can still probably go to the gym and do light stuff. Again, if the arm pain increases, you're doing too much. So it's a pain perspective, not a fitness perspective, but stay active to tolerance. Diagnosis of this condition. And then in about 75% of these cases, the diagnosis can be made exclusively by history and then physical exam. If you look at this chart right here, the different nerve roots innervate the different parts of our body. So we can use dermatome or myotome muscle testing to help further our exam. Cervical myelopathy, again, where that spinal cord is getting compressed or irritated. And then this causes upper motor neuron signs such as hyperreflexia, changes in gait, also difficulty with fine motor skills and tasks such as handwriting or buttoning your shirt. This chart, if you want to pause on it, is an exhaustive list of all the other differential diagnoses that can be similar to this condition. Is imaging indicated? Studies have shown that people in their 50s, 65% of those that are asymptomatic, patients that have no pain, show they have significant spinal degeneration on x-ray, most common at C5, C6, and C6, C7. And why this is important is as we age, our spine is going to age too. So as we get older, there's going to be more and more of these abnormalities. So they do increase the probability for this condition, but they don't necessarily cause it. These changes are also found on MRI, where this study found that people in their 60s, 57% had significant disc degeneration changes. And then conditions where imaging is indicated is history of trauma, any medical red flags, or failure to improve within 4 to 6 weeks. MRI is best for looking at soft tissue, and then CT scans are best looking at the bone. Injections and surgery. For injections, people do see a short-term improvement in pain of 1 to 3 months. However, this is more likely to be helpful if it's the disc causing the irritation rather than the bone. And then for surgery, again, most patients are recommended a conservative course of care initially, but some indications for surgery are progressive or sudden muscle weakness, signs of myelopathy, a fracture or instability resulting from trauma, or any medical red flags. And there have been a lot of medical advances of the different kinds of surgery, and there's actually 3 different options. But again, there should be a shared decision process between the surgeon and the patient. Thank you for watching our video on a pinched nerve. We hope you found it helpful. If you did, please like our video and subscribe to our channel. And don't forget to check out our other videos.